Welcome to Aronowitzland. I want to introduce today's segment, which is C-section scars. And first, a special shout out to Rachel, who suggested the topic and who is a brand new mother. Congratulations to you, many, many years of happiness and joy with the new baby, and congratulations to your husband and your whole family. So C-section scars are frequently a problem. I want to describe the different incisions that are used for the C-section, what to do post-operatively after you have the procedure, and then things that can be done later to correct scars that are unattractive or problematic. So stay tuned. We'll show you some scars and give you the care plan and some options for scars that are unattractive. So let's talk about C-section scars. There are basically three places the C-section scar can be. One is in the pubic mons, about midway through the mound. The next place is at the top of the pubic hairline, and the third place is going up and down vertically instead of horizontally. Probably the most common is just above the pubic hairline, and the doctor should go through the same scar every time if at all possible, and it's generally possible. If the scar is sewn up nicely, then it won't typically heal down to the deeper layers. When it does, what happens is it does this. It causes an overhang, and that's because the scar on the lower half healed down to the muscle, and the scar above, the tissue above, is puffy, and then over time it just is going to come down over the scar itself and cause a little pannus or little pooch, which nobody really likes. So I want to give you a few hints on how to prevent some of these problems. One is to discuss the scar with your obstetrician before the baby is delivered, before the C-section. And one of the things to ask is who's going to be doing the closure. Will you be doing the closure, doctor, or will somebody else at a lower level be doing the closure? And let them know that you're concerned about how that scar looks. Let them know that you've done a little research so that they take a little bit more time and do a nice job on the repair. The scar can be closed with staples instead of stitches under the skin. Dissolving stitches under the skin is probably my preferred way, but staples are perfectly fine if the staples are taken out within 7 to 10 days. 10 days is probably on the long side for most staples. The estrogen that a woman has in her body at the time of that the baby is delivered is a positive for the scar healing and will help. So what products to put on the skin after delivery? Well, a good moisturizer is very important. We recommend CeraVe. Cetaphil is very good as well. I think that as long as it's a product that has no perfume, that you've tried on your skin before, it really doesn't matter. The most important thing is you put it on the skin frequently and generously, so you have a good moisturizer. It's so important as the skin of the tummy and the skin of the breast is shrinking down a bit. The other thing is on the scar itself, once the sutures are removed or the little tape is removed, the next thing is just a silicone product. There are silicone sheets that are fine, but there are also silicone creams. The one that I recommend is called Biocornium. Biocornium, it's a silicone cream that you just apply sparingly to the scar twice a day. And that's all that's really necessary for about 3 to 6 months, depending on the redness of the scars. The redness fades, you can lighten up on the silicone use. And if the scar is getting thick or getting raised, probably a better idea to get in to see the plastic surgeon a little sooner rather than later, so that the scar can be treated with a steroid injection if necessary, or perhaps there are ingrown hairs or a retained suture that's responsible for the scar being thickened. So it's better to get some professional attention if the scar looks like it's not off to a good start.